Yes, ma'am. Please go ahead.
Thank you, ma'am. Good evening, everyone. We would like to wholeheartedly welcome each one of you for the mental health webinar. And this is we have it's a part of the Deccan Positive Mental Health group, and which has Manasa Shubhakara Mind Care, Forest Creative Arts Punjab, Sri Deepthi Counseling Center Hyderabad, Clover Learning Center Hyderabad, Sri Shah Counseling Center Kozhikode, myself. Today is a very, very special moment because we are into the 100th session, and our honorable resource person is Dr.
Anitaji, your video is freezing often and there is a break.
Okay, I think I have some internet issues here, sir. For the last 1 week, it has been like that. Can I continue? Am I audible?
Yeah.
Yes, ma'am. Yes, please.
Okay, sir. Honorable resource person, Dr. Srinivasan, sir, who is a senior psychiatrist, Kovai Medical Center and Hospital, Coimbatore. For an introduction to sir, he's a life member of the Indian Psychiatric Society, IPS, Indian Association of Private Psychiatry, IAP, American Psychiatric Association, regular personality development programs, only group therapy to involve patients and family members, and also involve large number of patients. And he has been into positive psychiatry and increasing the level of achievement of every participant in his programs, whether it is group therapy, personality development, or even his short presentations. And with that short introduction, I would like to hand over the session to you, sir. Here, sir will be speaking on the topic group therapy in the Indian setting. And over to you, sir. The floor is yours. Thank you so much, Mansur.
Thank you very much, first of all, for the opportunity given to me on the 100th meeting of the Deccan Positive Mental Health and all its partners. Thank you very much. So, this is a topic very close to my heart, and I have been doing it from 1995. So why, what, and how do we conduct group therapy? As I said, 1983, when I was doing my MD, working at the neurosis clinic of the Mental Hospital, Institute of Mental Health at Chennai, I thought we have to do something more than merely giving medication to people who come with anxiety and depression and all that. And I started gradually introducing the concept of just Jacobson's progressive muscular relaxation, and that itself was giving a lot of results. But then the seed was deep inside me, but probably took from 1983 to 1995, 12 years on the right place and the right time to do that. And 1995, I started my first group therapy. It was with a small group, so at that time I used to do it for specific disorders separately. But over the period of time, it gradually changed and evolved. And before going into the details of how I do it, I'll give a general introduction about the types of groups. Like it may be a guidance psychoeducational group, counseling and interpersonal problem-solving groups, psychotherapy groups, support groups, and self-help groups. Why I'm giving an overview about all these things are because, like in the group therapy that I am doing in that group, almost all these components are involved. Though it's basically a psychotherapy group, it has also evolved as a support group, and also it has become a self-help group, and also interpersonal problem-solving group, and also I use it for psychoeducational purposes, and we also involve the family members as well. What are the advantages of groups? Why should we do group therapy in the first place? Because one, groups provide a social atmosphere that's similar to the real world. more opportunity for social learning, can more easily learn interpersonal skills, and also can practice new interpersonal skills on each other. But the most important thing is like, see, I spent about 3 hours, and in that 3 hours, roughly about 150 patients and their relatives, sometimes even 200. The largest group I have ever conducted was about 250 people. That's patients and their families put together. For all of them together, I can give 3 hours of input, whereas each member, if I have to give that, then it becomes difficult and it may not be cost effective. Not only that, there is a lot of interpersonal learning that happens which cannot happen in a one-to-one therapy. So it also provides commonality, and members become aware of how others view them and what impact their behavior has on others. So group dynamics can replicate family of origin dynamics. In fact, we come across a lot of people, and then they sometimes try to dominate and people avoid, and all those things, whichever happen in the real life setting, happens in the group as well. So we have made methods to overcome that, which I'll be talking over the course of time. So members make public statement regarding change, and thus is more likely to follow through with the stated behavior, because like in the beginning of the session, like 1 to 1.5 hours, it will be experience sharing of the participants, what they learned from the previous session and how they implemented over the last month, and what are the difficulties they faced and what are the advantages they had and what benefits they had, what's the change that has happened in them. All that they share in the open with every other member. It gives a very good atmosphere, supportive kind of atmosphere where they feel secure and safe to share that kind of information. But at the same time, it also makes as a commitment that I have been doing it. So it requires or expects the group, puts an expectation on them so that they stick to their change. Members also receive feedback, support, and challenge that facilitate change. In fact, they ask questions, sometimes even controversial questions, which are allowed as long as they are constructive. And also it offers a diversity of perspectives. So you may be thinking only one-sided, one particular aspect of the problem or one particular aspect of an approach, whereas the group members give different perspectives to the same thing. So group therapy is more effective than individual one-to-one therapy. This is what I have understood over a period of time. You may be giving highly specified, effective, like CBT, DBT, whatever it is, interpersonal therapy or marital therapy. But I have found that it's a kind of therapy which encompasses all those aspects and much more. And also, it's a therapy which is a kind of evolving one. No two groups are the same. In fact, one of my friends came and observed this. And in fact, when I presented this in our Tamil Nadu chapter, a lot of people appreciated and said whether we can create a kind of manual so that it can be replicated by everyone. Then the friend came and said that, like, here, what you're delivering is something different and unique and specific to you. It involves a lot of your special skills, and the content is constantly changing over every session depending upon the interaction and feedback from the people and what they share in their like experience sharing. So this cannot be replicated by everybody. That's what he said. So it's a constantly evolving kind of group therapy is what we are doing. So this is one of the patients who said when they shared their experience. In fact, a lot of people ask me about the confidentiality issue, how comfortable patients are sharing their experience and their problems, and what problems with which they came and how the change has happened and all that. But we have never found that as an issue. So one of the patients said, I was treated with respect, listened to, not judged. I was able to say in public what my symptoms were and how I felt. I met other people who had what I had, which relieved the feeling of isolation. I learned from others of the group what worked for them and copied the skills that worked for me. I got compliments when I did well. I had a chance to give and get feedback. In fact, one of the psychiatrists who is doing his post-graduation now said that it was one of his long-term ambition to meet me because he was in a small town, tier 3 town called Namakkal, where he said some of the people who attended my group therapy sessions came home and said that how they went and attended the session and how they shared their experience and how they got compliments and all that. And he was, as a school student, he was astonished that mental health, somebody can come back and talk without a stigma and feel really happy that they went and attended and they could share it with others. So he took medicine and later on he took up psychiatry. At that time, he was able to get my contact and came and attended almost 5-6 sessions, and he was really taken aback. So what are the practical considerations in forming a group? What is the size of the group? In fact, as I said initially, I went with 8 to 12 people in a group and specific diagnosis, and males separately, females separately, because I didn't know how they will feel in the presence of each other. And it was a single diagnosis, so there will not be a mixture. Very, very homogeneous group. And we also matched the educational standards and all that. And it was like a closed group. It was 12 sessions. You have to attend from first to the 12th session. And if you drop out, there is no way you can make it up later. And there was no communication with the group members in between the sessions. And I tried from 6 sessions to 12 sessions, various ones, and finally stuck to this 12 sessions one. In fact, initially I conducted once a week, then once in 2 weeks, then once a month, various combinations I did, and finally I stuck to the once a month session because that used to be more practicable. And this cannot be done by everybody because you need a place for the group sessions, because I was lucky in working in a large hospital and also had a lot of classrooms. So when I had the small sessions, I had rooms appropriately, and when the sessions grew bigger, then I used to get even the conference hall of our hospital. And constantly I was encouraged by our chairman. And so the space was never a problem, but in a small clinic setting and things like that, even the space for the group sessions may be a problem. Then, of course, getting the consent, provide members with adequate information that will allow them to decide if they want to join a group. Because I conduct individual consultation with the person and attend to their problem and give therapy and other things on an individual one-to-one basis. And after 3 or 4 months, when I think that they are ready for the group, I just give the option to them. But out of the 100 people who are given an option, at least 5 or 10 will drop out because they don't want to join a group and talk, and they don't want other people to get to know what their problems are. Another 20 to 30% drops out because they are not able to keep up their commitment of coming on a fixed day. So these are all the practical considerations. So of course we provide what we expect, and some people I give them a chance that you just come and attend one session, and if you feel comfortable, you just keep coming for the entire course of 12 sessions. But if you are not comfortable, then they can drop out and then come and ask for individual consultation thereafter. The choice is yours, but when the choice is given, when they have attended experimentally, almost 95 to 98%, they felt very, very comfortable. They came back and said that I was really afraid, was shy, I got a lot of restrictions in my mind before attending, but after attending and after listening to all the people, then I have really felt very, very comfortable, and I think this will do me a lot of good. So I want to attend. That's the thing. That's when I started using this experimental one group. First session you attend, and if you like it, you can continue for the rest of the sessions. If you don't, then you can drop out and ask me for an individual consultation. That's the way I approached it. And the information which we give is what's the nature of the group. Patients will be there, their relatives will be there, and they will be sharing their experience. Over 12 sessions, what are all the various topics we will be covering, and what's the goals of the group and what you will get. And it will be for about 3 sessions, but only thing is you have to come on a fixed day, first Saturday, third Saturday, and third Friday. These are the 3 days, whichever one you choose, you have to come in the same time. And what is expected of the individual if they join? One, to keep up the timing and be participant, not merely an observer. And they have to do their homework, they have to submit their feedback, and they are expected to share their experience. And they are also expected to join a WhatsApp group where they share with each other during the course of the month. It is just not that one particular day, but the therapy is happening over the entire month with various group leaders. Then, if you are a leader, what's expected? So, what happened at KMCH, I'll let you know. Because the prevalence of medically unexplained physical symptoms the size is huge, and stigma is preventing them from seeking psychiatric treatment. And on average, they spend about 30,000 to 8 lakhs, and they take 3 to 5 years or 6 years. Sometimes they even go through 1 or 2 surgeries before they realize that their problems is psychological. So in this group, the psychological intervention lead to significant changes, and there, beyond medication, a lot of things are needed, and that's how the group therapy concept was conceived. Because first 3 years after joining the KMCH at 92, first 3 years I was seeing patients on an individual basis, and then over a period of time I thought, probably what I conceived in 83, the right time has come, and 95 is the year I started doing it formally. So first I do the individual evaluation of their physical symptoms, and then elicitation of associated events, establish the connection between, suppose somebody in the family has cancer, and after that he has developed symptoms like choking in the throat, or somebody dies of a heart attack and he develops chest pain. We have to establish the connection and how the fear and worry started. In fact, we explore in detail about the life situation, ask him to make a list of all the things. And initially, we give reasonable relief of symptoms of anxiety, physical symptoms, and sleep. Also give reassurance, hope, duration regarding subsequent disease. This is on the individual basis that we do. And then in that, one of the things which I have found very, very useful is asking the individuals to write and come. Because one, that helps the individual to understand his problems much better, the perspective much better. Also, once he writes and we are going through that, he is more in a listening mode. Otherwise, after my psychologist having spent almost an hour explaining everything, and when I formulate the therapy, he will keep interrupting with the new symptoms and new things that he wants to share. So like that, a lot of things we do in the initial identifying things. So we do the cognitive restructuring and control of heightened arousal. So arousal reduction is one of the important things. So what happened? As I said, initially I did the 6, 8, 12 various combinations. Finally, we arrived at 12 sessions, 2.5 to 3 hours. Now it's almost exceed 3 hours most of the sessions. And in the group process, the patient feels that I am not alone. My problems are not uncommon. And the process of sharing and eliminating stigma, in fact, group therapy constitutes a very, very major step in eliminating stigma, because before starting group therapy, they won't even sit in front of my room because it's a general hospital. They don't want other people coming to see a cardiologist or a gastroenterologist who happen to be their relatives to see them sitting in front of my room. So after starting the group therapy, they felt so comfortable. In fact, now the people coming to the group therapy, they keep saying that I don't feel like coming to your hospital. It feels like we are coming on a picnic to meet our friends, and after the meeting is over, small groups, they go and share their meal and things like that. So there is so much of bonhomie, and they exchange with each other. They eagerly wait for this day to come so that they can share. In fact, there was one patient who came to the last meeting, said that she has to start at 2 o'clock in the early morning and come here at 9. And she told her husband that the meeting is at 9 o'clock instead of the usual time 10, because from 9 to 10 she wants to share and exchange with her friends what was happening. So it's like the school friends or people. So that is the process. As I said, initially males separately, females separately, then as a chance coincidence, we started putting them all together, and then probably the relatives who came did not understand what the process is, so we started admitting the relatives as well into the group, so they understood what the process is. Also, the cooperation of the relative was better, and the improvement in the patient was even better. So what are the group leader skills that are needed? Like when somebody shares their experience, we need to clarify, and then linking the various things, suggesting, interpreting, facilitating, modeling. And if something not necessary or something is going on a length, then block it. Then summarize and termination. These are all the various skills that are needed. And of course, I explained the mind-body connection and how it's done. One of the important things that is focused. First 3 or 4 sessions, we focus on the reduction of autonomic arousal. We use various techniques. Then, of course, I also teach them relaxation, hypnosis, and some NLP tools as well. Then, of course, the value of homework in groups. This is one thing very, very important. In fact, we divide the entire large group. Somebody asked me, how do you manage such a large group? Then I told them, they are divided into groups of 5 people, and each 5-member group is assigned a leader, and these leaders together form a WhatsApp group, and all the patients are put together in a WhatsApp group. So this was really made possible by one of our patients. Vishaka Parvati was the person who started it in one group, and then Positive Friends was the name given to that group, and then we also replicated that in other groups. In fact, I can very distinctly say that before and after this WhatsApp group was started, the results were phenomenal. The connection between the patients were really excellent, and each one started supporting other. When one is down, the other person is able to lift, and that person needs help, somebody else is there. So that way it really works, and the homeworks are also being monitored, and each one remains the other, and then they also form a particular time to do some of the exercises. So what operates in the group is like the self-disclosure and the feedback, hope, willingness to risk and trust others, caring and acceptance, catharsis, of course, and the cognitive component, commitment to change and freedom to experiment, of course, a little bit of humor. These are all the things. So this is a sample of the feedback. One of the exercises we give is planning the day for 5 minutes. So the person attended only 3 sessions. After that, he couldn't come because of the COVID that started. So he said, even after attending 3 sessions, this is the excellent feedback is given. This very effective tool in managing my daily routine, especially during this period. I had my final examination. If not for the planning of each day, I would not have achieved the good score in both these exams. I was able to effectively use my time and get the best out of each day. Nowadays, for figuring out a best plan and a detailed plan. I spent about 10 minutes each day. Normally, I said 5 minutes planning. Then observing the breath. Of course, I go oversimplified the Vipassana meditation. Just I told them, you don't have to concentrate on anything. So only 3 things: observing the breath, then observing the thoughts, and observing the emotions and the bodily changes. These 3 are combined into it over a period of time. You just try to log in for 30 minutes, but not necessarily 30 minutes together. You can do it in bits of 3 minutes, 10 times, or 3, 5, whatever you can. So this has again helped him a lot. I'm just rushing through for want of time some of the things. And 1 hour, 1 minute is one of the tool. At the end of 1 hour, you just close your eyes and then recollect what has happened in the last 1 hour. This has served as a memory tool. Not only as a memory tool, it also serves as a self-correction tool. Then, of course, stress diary, because most people have stress, and stress is a starting point for anxiety, depression, or any other disorder. So I asked them to write a stress diary, and that helps in a lot of ways. Then, as the planning in the morning, review for 5 minutes in the night, and then 3 things I am grateful for from one of the positive psychology tools. So this again gives them a lot of things to change and the change in perspective. So overall, during these past 3 months, I have accomplished several feats like scoring a 9 GPA in my exams and clearing the GRE examination and working with great cooperation with my team to finish my final year project. In fact, this person came with a irritable bowel syndrome, and we have been investigated for 5 years with various doctors with multiple procedures, and finally we found out to be just a case of anxiety with minimal obsessive tendency, and he was out of medication in about 7 to 8 months' time after all these exercises. Another thing is the power of appreciation. We teach them and how to appreciate others and also give it in writing. This is one of the things that we teach. This is just a sample of some of our groups. So applying what is learned in group to everyday life, like low self-esteem is one of the important aspect in almost, I did a session on low self-esteem and various psychiatric disorders. If you look at it, anxiety, depression, obsession, almost all these things, people who have a low self-esteem, when they experience stress, then they decompensate. Low self-esteem leads to depression. Low self-esteem leads to probably a lot of other psychiatric disorders. So if you can correct low self-esteem, you can also correct a lot of the psychiatric disorders at the root level. So that's one of the sessions that we do. And of course, emotional awareness and how to manage anger and most of the negative emotions and how to take charge of your emotions, impulse control and emotional regulation. All these things we focus on one session. Then of course, assertive skills, we teach them. Communication, how to improve the communication, way to precise, what's the role of listening, understanding, and criticism versus feedback, all this. Because this transcend across, like whether it's a problem and conflict between couples or between parents and children or good parenting practices, everywhere there's some of the things that I talk about transcend across all these. So that's interpersonal relationship. So you need to understand what I call the 4 pillars of relationship. That's love, trust, respect, and intimacy. And also the concepts borrowed from Stephen Covey, emotional deposits and emotional withdrawals, having the end in mind, and parenting skills are also taught among those things. And of course, one of the important things, and initially why I did the sessions for males and females separately was because of this particular session. But then later on, I found that nowadays people are very comfortable discussing in a common thing. In fact, one of the patients came and gave me a feedback that, Doctor, so far what was only available for the medical students, you have given to all the common public, and you have eliminated a lot of myths and misconceptions we had in just about 3-hour session. And in fact, this is needed in schools and colleges. That's the way some of the feedbacks. And surprisingly, in the last 2 days back, I came across 3 students brought actually the nucleus was by the one parent who said, I wanted to take my son for sex education, and then 2 other people joined, 2 male students and 1 female student, all of them completing their 10th standard, was brought to me just for giving sex education. Doctor, we want our children to have this, no other problem. So I asked them to come the next day. I assigned a male therapist for the 2 boys and the female therapist for a girl. And after the 1 hour session, they came back and all of them said they came to know a lot of things, and then most of their doubts are removed. And I told the parents, in 1 session, we have done the maximum. Thereafter, the same-sex parent can be in touch with their children, and if there is any new problem or anything, they can come to me. That's what I told them. So what are the other aspects? We talk about goal setting and behavior change and commitment for the lifelong. In fact, a lot of people ask me, Doctor, how long should I practice these techniques? I told them it's for the rest of your life. It's free of cost and available easily. You don't require any other tool to practice, so you can do it anywhere you want. So as long as you keep practicing it, you don't have to come back to me. The moment you stop it, within 3-4 months, you may develop the problem again. In fact, in one of the presentations, one person very clearly said, in psychiatry, we talk about disease very rarely. Most of the time, we use the term disorder. But you have probably gone to the next level. It's a adjustment reaction. And once you teach them the skills, you are able to adjust very well. Probably you have changed the concept from disorder to adjustment reaction, and that's why all these things are for you. So sustained change in health can attain only when people are empowered and motivated to change the quality of their lives in general and the quality of their health in particular by changing their behavior on a permanent basis. This is achieved by changing thoughts, feelings, actions, habits, and character over a period of time. And I do this by using group process. So sometimes the things I talk about may look like faith healing. Am I trying to be a new age guru? Definitely not. I still deal with science and remain within the realms of science. So thank you very much for your patient listening and the wonderful opportunity. I'll be happy to take questions because I didn't know what was the exact time that was allotted for the presentation. I just rushed through in some of the areas. Probably I have taken about 35 minutes. Whatever time that's left, we can use for discussion. Thank you.
Yeah. Thank you so much, sir. It was a wonderful session. We thoroughly enjoyed. We follow your mission and vision as per Suresh sir guidance. First, we started with 4 persons, sir. Myself and Merlin and Dinakara sir. I think Manjula Ramesh and Suresh sir. We started first session, very first. Then I think 67 resource person till now. International speakers from US, UK, and Germany, Bahrain, UAE, and South Africa, and West African country. Yeah, we spread positivity and creating awareness, mental health, wellness in a holistic approach. Yeah, thank you, sir. Suresh, sir, please go ahead, sir. You can share your thoughts about our association.
Yeah, thank you, Sunanda. Sir, please accept our gratitude for the very important topic that needs to be created awareness among the people who are practicing mental health. As I told many occasions, the same I would like to say here. When we are practicing, it is not only meant for dealing with illness or diseases, we must focus on making them into positive side. And when I'm looking at the review of literature or the studies done by Westerners, mostly comes from Westerners. That is the idea I have. When I met Srinivasan sir and I had interactions, I come to know that he is doing these practices more than 3 decades. Here in India, it's more than 3 decades, and almost is more successful. It can be witnessed through the number of participants who are participating, and when we interact with some of the members, we can easily understand the importance of having positive group therapy. And it not only makes the person change in the person alone, it makes a lot of change in the family members. Um, uh, I think you made an amazing initiative in India. But I think the management also supported your initiative. And like a few occasions, I like to quote the numbers over here. There are, based on this vast experience, um, seniors used to say that there are two important components in positive. That is, when you want to be on well-being state, two basic qualities we need to have. He used to say that psychological well-being, one is self-esteem and another one is resilience. And when a person having these two qualities and they can able to um, overcome many of the negative components and they can do a lot of other things in their life. And the other thing is that when we say something, it must be scientific, not on logical, not based on the belief system. That's the main thing I learned from research. I think this positive mental health group also, in the beginning days when we had a discussion, I still remember with Sunanda and other members, um, when when we say positive or physical component, when we include that, we must include the scientific component alone, not include non-scientific component. I think that's what really we learned a lot from you, sir. I think today the new members over here also aware about that. There's a pioneer in positive group therapy in India. That is Dr. Srinivas, sir. He is from Kovi Medical College, and he's a senior most professor psychiatrist over there. And we are really enjoyed, and we are really happy to be as learners from your session, sir. And now the forum is open for the Q&A. And members, if you have any questions, you can unmute yourself and you can ask. I think Ms. Sunanda will take over that. And before that, I'd like to one word to the DC, the positive mental health. And I still remember it was the simple talk we had with Sunanda and small group of members. And now it reaches with many speakers, and there are many programs that are conducted, and few newspapers were published by the positive mental health. And I think it is an amazing achievement. I think I like to appreciate, I like to acknowledge the efforts made by all the members of positive mental health. Okay.
Thank you, sir. Yeah, Venugopal, sir.
Okay. Srinivasan ji. Now, that is, I don't know whether you are aware of the term Ikigai. Today, in that Madurai, that one webinar group, Dr. Vidya Iyer, she gave a talk on Ikigai. That is the reason for living. And now, after listening to this talk, I find that you have discovered your Ikigai. That is since 1995. Okay, you have been actively doing this great job, especially group therapy in USA. Because I'm in USA, and I have been working in a large federal government hospital. The clients are veterans. Veterans are the Vietnam War veterans, then Korean War veterans, and the Iraqi, and all those things. And most of the patients are above the age of 65, almost 90% of the patients. And a significant number of them, they suffer from loneliness. So that is where I started some group therapy sessions for loneliness. And there, as one of your slides you mentioned, then they realize it is not uncommon. I'm not the only person who is feeling lonely. Otherwise, they feel very miserable. Now, that one subsequently helped them a lot. And I was able to share some usual practical tips in how to cope with that loneliness and how to convert loneliness into solitude. From loneliness into solitude, you enjoy your own company. So group therapy works wonders, and I'm really happy that you are doing it, and it's a very good service. Okay. I enjoyed your session, and you know how to share your ideas and thoughts effectively and efficiently. Thank you.
Thank you, sir, for your appreciation. In fact, like you said, Ikigai, I have spread that word also. Like more than 1,600 sessions we have done. In fact, one of the patients said that I have been coming for the past 12 sessions and I thought at least one may be cancelled. But not even one session has been cancelled so far. That's the way it has gone. So on the fixed day, the session will go 1,600 sessions since 1995. That's what we haven't had to cancel even a single session. In fact, because of the WhatsApp group, last month we fixed 19th as the third Friday session. Then 20th only the announcement came that the elections in Coimbatore are on April 19th. So one patient, the leader of the group asked, sir, what should we do? Then we said, okay, we'll make it 26th and inform everybody. So this month alone, instead of 19th, the third Friday session will be on 26th. So it will go on. Once it's there, it will go on. Not even a single session will be missed. And that's the way, like because of the commitment and passion, we have been doing it. Okay, I think somebody has raised.
Yeah, Vinita Cherial, sir. Vinita Cherial.
Yeah. Thank you, Dr. Srinivasan. I'm a community physician. So my question is, it was a very arousing presentation. Thank you. I'm sure there are many gaps, but you've tried your level best to bridge the gaps and give us some, really inspiring presentation. So with regarding to application of your science to community medicine, so this kind of group therapy, is it like only for disorders? Do you focus on positive mental health? Like because we could apply it for health education measures, like, because major chunk of the population, I think this kind of positive mental health, that is something which is really in need.
Yes, actually, though we take patients, the most of the things that we talk about are not illness oriented, but it's about positive mental health. So their illness is mostly cured by the individual therapy and the medication. So all these inputs are to improve their personality as well. So I also, in fact, in the introduction, probably what was missed was I wear multiple hats. One is like a psychiatrist. Another one is I conduct a lot of personality development programs. There again, I do it over 12 weeks every Sunday, like that. So all these components are mixed, so it can be used for public education, improving their personality, giving in a lot of inputs. All that are done in the same format.
Okay, so this kind of group dynamics, this kind of, I'm not alone, my problems are not uncommon. So, so do you really walk into the community, outreach, reach out so that you bridge the gap? It's kind of, how does it work in KMCH? Because I'm also working in a KMC, Karuna Medical Center in Palghat. So.
No, I don't reach out to the community. Probably I bring the community into my room. So as of now, I'm not doing any community work, but I chew it in the patients and probably they take the message to the other people as well. Like as I said,
yeah, because you see, when a husband talks to a wife, that kind of an intimacy, and they come to loggerheads many times. So now we're thinking of a group which is like, I don't know. So
yeah, probably I don't know. Like this message was shared in our positive group as well. If there are anybody who is from the group Chitra or somebody is there, I can ask them to speak. Like so far, we have not encountered much of a problem in this, managing these groups and their individuals. So if there's anything that's brought to my notice, and then I just put it across to the person who is creating some problem. So as I said, it's going on from 1995. It's going through a lot of evolutionary process. And as I said, it's constantly evolving and changing.
Thank you, Vinita. Yes, Samyukta,
Thank you.
please
Thank
go
you.
ahead.
Yes.
Hello, sir. So I'm a master's student. I'm studying counseling psychology. And as part of my master's, I'm researching group therapy in India. So I had a few questions from what you'd said. One of the questions is with the open group and closed group. So I think your groups are mostly open where
Right.
they can join at any time. How does the group process look like when it's open rather than closed where it's the same people? And another question on the same lines is the group size. You mentioned it's a larger group. Is that because of lack of resources, not enough people to handle smaller groups, or do larger groups work better? These are my two questions.
Okay. As I said earlier, I was conducting even 8 to 12 sessions in a month. I had some assistants and all that. So if you look at the participation and the dropout, if you take these two main factors, then small groups don't work. So the effectiveness is better for larger groups, because in a group, probably only 10 to 12% are more communicative, doing their homeworks better and willing to share their experience and all that. So if you're working with a 12% group, then there are only 2-3 people doing that. So when you have a 100-strong group, 12 to 15 people are willing to do that, and that creates a much better momentum. Then when there are about 100-120 people are incorporated into a group when it is started, even there is a 10 to 20% dropout. Dropout in the sense that they don't drop out, but if you take 100 people into a group, out of which only 20 to 25% will be attending all 12 sessions. So there will be like other people will be missing 2 to 3 sessions. So number will be smaller. So the motivation for the person to spend about 3 hours will be lost if it is a smaller group. So I have found that larger groups are more efficient than smaller groups. Unless otherwise you are dealing with deep-rooted problems which you need to really spend time individually, focus. If that's the kind of problem you are dealing with, then you will need a smaller group. Otherwise, I would any day, even if there is an option, even if I have resources, still I'll work with a larger group rather than a smaller group. Okay? Regarding open and close, it's not completely open in the sense that we start with about 100 to 120 people. As I said, there is a first Saturday group, third Saturday group, third Friday group. So we start the first month, the first Saturday group, then 4 months later, 5th month, we start the third Saturday group, and 9th month, we start the third Friday group. So somebody misses 2-3 sessions in the previous one, then they will be losing out, so we ship them out. Or somebody who says that I don't want to wait till the start of a next opportunity, I want to enter in, they are allowed. So that's the only way that they come in between and they get integrated into the group. Instead of like schools or colleges where somebody who comes through the same school and somebody comes from a different school comes into the 9th standard, then he will be isolated or he will find it difficult to get integrated. Whereas here, like the integration is much easier. So even though it's a open group, still the integration is made much easier and the transition is made smoother. That's by the supervision and the support.
Thank you, sir. I just had one more question.
Yeah.
How are they seated usually in your practice? Are they seated in a circle, or is there a particular way you seat them during the therapy?
No, there is no particular. It's like the regular galleries seating, not the circular other thing, because we don't give more activities and things like that. So it's like not exactly a lecture, but people share their experience and I give the interpretation and they keep taking notes and things like that. So it's the regular classroom seating.
Okay, thank you, sir.
Okay, thank you.
Thank you, Samyukta. Satyan, sir. Satyan, sir, are you there?
Yes.
Yeah.
Yeah, please go ahead, sir.
Good evening, doctor. It's a wonderful session. You made it a beautiful path from academic to practice, and a person who has really come out very well. One, and is group therapy successful with mono group or another group type of a mixed group as such.
Can you explain what's mono and what mixed? When
Mono, for example, now we have a college students in a classroom, and for example, 10, 15 are there, or now PG students in a particular classroom. And for example, so that's how I feel the mono group as such.
Okay, here it is the patient group. So for them, when I do it, it's a completely mixed group. The age group is from 25 to 75, and males and females, different educational standards, all that. It's a completely mixed group. So that's the way practically it works, because it brings different perspectives. In fact, taking the same to the personality development, my own personality development program also almost run on the similar lines as the group therapy. There also we have a very wide mixed range, because that gives a different perspective. In fact, there we used to give group activities, and one of the parents said that when I sat with a student and discussed, then only I could realize the different perspectives, and that changed my perspective towards my own son, and after that my relation with my son changed. That's what he said. So I would probably take it as a mixed group, brings in different perspectives, diverse perspectives, and that way it works much better. Unless otherwise you want to give a focused kind of information, then probably the mono group will work better.
Very good, sir. Very good. Thank you so much.
Thank you. Thank you.
Thank you, Satyan sir. Yeah, our supporting pillars are Jyoti Raja ma'am and Sudha Ramani, Kalyani Garimala. Yeah, you can please interact with sir. Ashish ji.
No questions, ma'am.
Okay,
I'll
sir. Yeah, Rakshaya Sudarshan.
Yeah,
Yeah,
I
please.
just have one question, ma'am. Sir, can you please share the difficulties you faced during group therapy so that we can easily handle that? Can I know about that, sir?
No, initially, like there was resistance in 1995 when I started. People were resisting to come, so that's one of the reasons. Probably I went in for small groups. I just played around and experimented and got my experience and all that. And after that, as I said, some people don't want to come into the groups. Then they are finding it difficult to come on a fixed day, fixed time. These are some of the difficulties. Number three is like people who are illiterate are also put into the group, so they are finding it difficult to give the feedback or share. Of course, some people are comfortable talking, and as I said, in my main aim of making small groups is that like everybody should come and share their experience in front of others, so that each person will have at least 2 chances. But it very rarely worked, and the same few people who continue to do that, they continue to do. But it definitely percolates, as I used to say, like most of the teachers used to say, we have 3 types of people. Somebody like a camphor, and somebody like a charcoal, and somebody like the plantain, this thing. So somebody who just takes it immediately, they are the ones who share it. But after that, few sessions, the next group comes in, but the lost benchers, some of them happen in the therapy as well. But I have said, it's not like 12 sessions anymore. It's ongoing. You can continue to come as long as you continue to take medications and things like that. So there are some people who have attended 3, 4, that is about 36, 48 sessions of group therapy as well. And some people who are late bloomers, they find the result only after attending about 2 sessions. That's about 20-24 sessions.
Yeah. Thank you, sir.
Thank you,
A
sir.
quick request to Vinita ji. Vinita ji, I am also from Kerala. I understand you are from Kerala. So I would appreciate if you could share your WhatsApp number to my WhatsApp number. I have shared my WhatsApp number in the message box. Thank you.
Oh, thank you,
you,
sir. Thank
sir.
you. I'll do that. Yes.
Yeah, Kalyani ma'am.
Yeah. Good evening, everyone. I would like to thank Sir Srinivasan sir for such a wonderful session. You have thrown light on different aspects. The presentation was very comprehensive. I'm sure you would wanted to, share more because you had to rush through this thing. But yeah, then it was very informative, and we knew about group therapy. But what you have shared is, a very different kind of practically how you do it, and lots of questions have been answered for us. So I don't have any questions as such, but I really would like to congratulate you and Sunanda ma'am and the DPMH team for organizing this session. We would love to have you again, sir, on behalf of DPMH for further sessions. And if you ever have any session, please let us know. We would love to, interact with you and, really enjoyed your session, sir. Thank you so much.
Thank you very much, madam, for the appreciation. As you rightly said, I don't follow a fixed pattern of group therapy. As you said, probably the textbook pattern. It has evolved over a period of time, and I have made my own things.
Yeah, I know. And what matters is that I'm sure you're very happy with the results.
Yeah.
I think that is what matters the most.
That's right.
I'm sure it's very satisfying for you.
Yeah.
Thank you.
Thank you, sir.
Yeah. Jyoti ma'am.
Yeah, good evening, one and all. This is really a wonderful session. So thank you very much for throwing insight in a group therapy, which normally people don't talk about it, basically psychiatrists. But this is one of the, I think, it's creating a curiosity in me that how we are going to do it and what exactly the result. Any given chance, can we do it like online? Can we it online, or can we visit that when you're doing the group session?
No, the problem is we do it in person there. So from there to create a link, Zoom link or something. I mean, like a lot of people have visited me and attended the session, and they have found it. There is no reservation in anybody attending the session. My patients are very comfortable and outsiders sitting there, observing or whatever it is. But make it a Zoom, it only makes it like technically difficult. In fact, during the COVID period, I conducted the group therapy over Zoom. Initially, there were more than all the three groups put together on third Sunday afternoon, 3 to 6, we made it. So initially, there was a lot of good response, and after that, people dropped out, and towards the end, it's only about 20-30 people coming regularly. So luckily, COVID ended and we restarted thing. Otherwise, almost for about 24, 30 plus months, we didn't do it, but we kept the contact through.
Okay. It's really a wonderful session, sir. Once again, congratulations, Sunanda, for keeping this group active throughout. I think conducting online 100 online sessions is not that easy. I know how. I know your struggle behind it, the pain and how much efforts you take up. You really deserve a big clap, Sunanda, for this. Actually, you really deserve that. I hope we continue. You continue. Not you. We support you from our side. I think definitely we'll continue. Maybe we'll celebrate the 150 and 200 session also in this platform. Then we'll call sir for that in between again. So once again, I congratulate Sunanda and her team for conducting a wonderful session. Thank you, sir. It's really a wonderful session. We enjoyed it thoroughly.
Thank you.
Thank you.
Thank you, ma'am. Yes, Sudhagar, please go ahead.
Yes. Thank you so much for enriching and enlightening. Actually, I'm an art therapist. I'm doing a post-graduation art therapy. Group sessions are must and mandatory. I mean, very helpful in conducting art therapy sessions. I have experienced as a member of a group many a times when our faculty conducted group sessions online only, but wonderful connection happens. Whatever points you put across in the session, I could say that I refreshed my knowledge about group therapy. Thank you so much, sir. And I'm looking forward for many more sessions from it, sir.
Thank you.
And Sunanda, thank you. Congratulations and thank you for making us a part of this beautiful group, enriching group, enlightening group, I should say. Thank you. Wishing all of us, wishing you and others, all of us, many more centuries maybe. Centuries in the sense sessions.
Yeah, thank you. Thank you so much. Yeah, Manimegala Munich.
Yeah, good evening, one and all. My name is Mani Meglai. I'm working as a psychologist and group doctor. This is a wonderful and very informative session for me. After seeing your session, I got an idea whether I can use group therapy for the students' parents, because I can see alcoholic, infidelity, irresponsibility also. As a parent, they don't know the responsibility. Whether I can...
Yeah, definitely.
work
You
on
can
group
do it. If you want any collaboration, any help from me, I am ready to do that.
Thank you so much, sir. Because when I counsel the student, I come to know it is from a dysfunctional family. The students who are suffering are mostly from dysfunctional family. So that is the core where we have to correct them. This I didn't know the way how to do this, so I got a doubt. Just I want to clarify with you.
Definitely.
And I really need your help. I really need your help in this, sir.
You can engage the parents probably once in a month or twice a month, like that. 3 hours may not be possible for them. 1 hour sessions may be possible, and then from there, like over the course of 6 months or something, you can again plan. Somehow I am stuck and happy with this 12 sessions. I don't know where I got it from. I think 12 is a unique number. Anything less than that doesn't work. More than that probably looks too much. So somehow you schedule 12 sessions, 1 hour each, and then probably different contents each time. And when people feel the change and when the students experience the change, that will be a very, very satisfying moment, and it will also produce momentum for the sessions as well.
Very true, sir. Okay, thank you, sir. I'll get from Sunanda ma'am your number and other things for
Sure. I'll be happy to help you in anything.
Thank you for this enlightening session, sir. Thank you so much.
Yeah, thank you, ma'am. Yeah, with your permission, we will allow one more participant, sir. Yuvarani.
Sure, I don't have a problem with time. Yeah.
Yeah, thank you very much, Sunanta ma'am. Sir, good evening, sir. It's a wonderful session. Sorry, I came a little bit late. As Mani Meglai said, I'm a Montessori teacher's trainer. So that my thing is, I want to share my feeling. Can I come and share all the obstacles what I had? So that if you allow us, so that we can share to your group.
Yeah, sure.
So if so, where to contact and.
You can probably get my number from Sunanda madam, and then probably we'll get in touch and organize how it can be done.
So that your group can be, your work will be easy, I think. So because as a common person, common man, we can share our obstacles, like how we have overcome all our difficulties and what are all the things we even self made and all, so that it will be, so that we can share our things. So I thought like that. It's very good, sir. Thank you, sir. Thank you.
Yeah. Thank you, Yuvarani. Satyan, sir, you want to interact with sir again?
Yes, sir. Doctor, I'm from Anugraha, that is Dindikal Anugraha Arts and Science College, and we also conduct group therapy. Yes, and one thing, how do you differ this Alcoholic Anonymous when they come together, they talk and they try to really help themselves, and that particular session, how do you really understand or differentiate from group therapy, sir?
No, group therapy is different from a self-help group. Alcoholic Anonymous, I'll consider it as self-help group.
Okay.
And they don't have different contents on different days. It's an ongoing session. And it's not fixed. Here, a member joins, he attends at least 12 sessions, and each session has a different structure. And as I showed you, the various aspects, and that's what we aim at. That's they just share their experience and they continue to do that, and how they came out of it. And somebody has some difficulty, somebody guides. So it's more like a self-help group.
Okay.
So told you about the 5 different things. One among the thing is self-help group, whereas the group therapy has a lot more than the self-help group.
Thank you, doctor. Thank you.
Okay.
Thank you, Satyan sir. Yeah, friends, you want to interact with the doctor? I think we can conclude today's session, sir, with your permission.
So before that, I also congratulate you for achieving the 100 as the milestone, and as somebody said, it will go to 200 to 300. Suresh sir, because he is doing it daily, he has gone beyond 1,000, but you are doing only once a week, so 52 is the maximum in a year. So like even to reach 200, it's going to take another 2 years, but consistency is what makes it work. And congratulations and well done, and best wishes for you to reach many more milestones. Thank you.
Yeah, thank you, sir. With your support and blessing, and Suresh sir blessings. Yeah, we will do that. Yeah, thank you, participants, and thank you, friends, like supporting Pillar Jyoti Raja ma'am and Sudharamani, Kalyani Garimada. Yeah, I thank each and everyone in association with Yellow Pond India and Forest Creative Arts Studio Punjab, then Sri Deepthi Counseling Center Hyderabad, Clover Learning Center Hyderabad, then Sirisha Counseling Center from Kozhikode, then Mindstyle Hub Kolkata. We thank each and everyone. We will meet next week, same time with the other resource person. We thank you, sir.
Thank you.
Thank you, ma'am. Thank you, everyone.
Sunanda ji. Mr. Manishankar, you contact me and I will share the video with you.
Thank you, sir. Can you share your number, please, sir?
I already shared. It is there.
Congratulations, sir.
Sir, where can we get the recording of the session, sir? Please. Hello, sir. Where can we see the recordings of this session?